You are listening to The Summit. I'm Chad Miller, here with Dr. Brian Law on the phone from Crystal Clinic Orthopedic Center. He is a foot and ankle surgeon at Crystal Clinic and specializing in surgery of the foot and ankle. He sees patients in Canton, Cuyahoga Falls, Independence, Solon, and Warren. Dr. Law has earned his medical degree from the Medical College of Wisconsin. He completed an orthopedic surgery residency at Medical College of Wisconsin-affiliated hospitals and has also completed an orthopedic foot and ankle fellowship at Dr. Roger A. Mann at the Oakland Bone and Joint Specialist in California. Quite the resume there, Dr. Brian Law. Good to hear from you. How are you today?
I'm doing well. Thanks for having me, Chad.
Absolutely. So, your specialty is foot and ankle surgery, and I want to talk about that a little bit here. What is the difference between a total ankle replacement and an ankle fusion? That sounds similar, but I'm sure there's many differences there.
Well, so both surgeries are done to address pain from arthritis in the ankle. An ankle replacement replaces the joint with an artificial joint. I'm sure you probably know people who have artificial knees or hips,
oh, yes,
maybe shoulders. So it's the same thing. We're kind of replacing the broken down joint with some metal and plastic to take away the pain so that people can function better. It maintains the motion of the ankle, kind of really helps people maintain more function. An ankle fusion is also done for pain from arthritis. It's, I would say, an older-fashioned procedure, something that was done before we had the option of having ankle replacements, where you actually take the two ends of the bone, roughen them up, and then fuse them together, make them grow together, become one solid bone by putting screws and plates and things across it to hold it in place. Eventually, once that fuses and becomes a solid bone, it doesn't hurt anymore. So you do accomplish the pain relief, but you're sacrificing the motion. So you can't move that ankle anymore once that's done.
Well, when it gets to that point, I mean, you just said it. I mean, you can only take so much pain. At what point should a patient consider a total ankle replacement then?
So that's really, I tell all of my patients that it's a really personal decision because this is not a life or death. Mm-hmm. This is definitely a quality of life issue. You can live your life in pain, which you probably don't want to. But once you've reached the point where you no longer really want to deal with that anymore, it's really affecting your quality of life enough. And that's different for everybody. So there's not like a standard rule. Is just that when your quality of life has been affected enough by your ankle pain from arthritis, that's when you really should consider some type of surgery.
Well, then it sounds to me like is there an ideal age for total ankle replacement? And this could happen to anyone at any time then, right?
That is true. I think if you ask people, ideally you would want to wait as long as possible, just because these have a finite lifespan. They're man-made, so they will wear out with time. And when they wear out, you have to redo it usually. Or sometimes if you've reached the point where you can't redo it just because of bone loss or other problems, then eventually you're going to have to look at fusing it. So if you can kind of avoid having multiple other surgeries in life, that would be the best. So, if you ask people, the ideal candidate is usually somebody who's older, who is less active. But that being said, that doesn't mean that younger people shouldn't have ankle replacements. When your life is affected to the point where you can't continue to do what you want to do, I think that an ankle replacement is definitely an option. It's not something that we can say will last forever, and you might have to have more surgeries in the future. And you might eventually need to just bite the bullet and say, okay, now it needs to be fused.
Right.
But you get at least, you would hope to get several years, hopefully several decades of good function and pain relief from the ankle replacement.
Well, what is the expected recovery time after an ankle replacement surgery and once that process is completed?
So every surgeon has a slightly different protocol. I usually start letting people put at least part of their weight and start walking a little bit after 2 weeks. Mm-hmm. So for the first 2 weeks, I want everybody to rest. Just rest, keep the foot elevated, kind of stay off it and not really do much. Once we get the first recovery stage through, then I start letting them put half of their weight down for 2 weeks. Then I start letting them put all their weight down for 2 weeks in a boot to protect them, but they can start walking around. And then we start physical therapy. So most people, I would say, are back to doing most normal activities at about 2 months.
All good information to know. Dr. Brian Law, an orthopedic surgeon at Crystal Clinic Orthopedic Center, specializing in foot and ankle surgery. For appointments or more information, you can call 330-668-4040 or visit crystalclinic.com, where you can now schedule an appointment online 24/7. Again, Dr. Brian Law from Crystal Clinic Orthopedic Center. Thank you for sharing your knowledge today on this topic. Thank you.
Thank you very much for having me.